This is a very good question. The organization of the whole process of the egg donation is a delicate process, of course. On one side, we try this to be for the patients as easy as possible. Of course, there is a big team who is cooperating all the treatment by the donor, by the recipient, and so on. Because the majority of our donor programs in our clinics are offered in the fresh eggs, it means that there must be a precise synchronization between the cycles of the donor and recipient. So this brings the advantage of the better outcomes in the treatment, thanks of the fresh eggs, because fresh is always fresh. Yeah, but there could be some points when something could go wrong, of course. For example, there are some unexpected situations which could occur during this process. For example, there could be some unexpected bleeding during the synchronization, because for the synchronization we use the birth control pill mostly, which is mostly the best accepted by the patients and by the donors as well. Yeah. For example, the period could be delayed, there could be some intermenstrual bleeding, and this was the synchronization. So it means it could, for example, delay the time for the transfer of the embryos. So the next thing could be that the donors could produce less than expected amount of eggs. In this treatment policy, we are respecting, of course, the rights of the donors, and on the first point for us is the safetyness of all sides, so of the donors and of the recipients as well. So, of course, whatever time the donor could decide to finish the treatment and not to go through the process of the egg collection. This happens very rare, but of course we must inform the patients in advance that this could happen. Yeah? But whatever happens, the staff of the clinic is trained for those unusual situations, and our egg bank, for example, has always a reserve of frozen eggs. But if we use the frozen eggs, we always discuss this with the patients. This is a special situation because, as I told before, we are trying to use the fresh eggs for the fertilization, because this brings the best outcomes of the therapy. Yeah. Especially, for example, the donor eggs are used in the situations when the patient has already bought the flying tickets, they are ready for the treatment in a specific time frame, and they cannot change, for example, the time of the stay here in Czech Republic. So next thing could be that during the process, some of the patients are not reacting on the medication. For example, the endometrium thickness is not properly enough for the transfer. This should be at least 6 or 7 millimeters, because then we have the best outcomes in the treatment. This adverse event could lead, for example, to the change of the type of the medication during the preparation. And if the patient doesn't react on it, we try to make such a probe cycle, which could show us how the patient will react on this medication next time, for example. Next thing could be that the man is not able, for example, to get the sperm for the fertilization. This happens sometimes, of course. It's very stressful for the man to come here immediately at the time to the clinic to win the sperm. This should be actually, of course, discussed in advance with the patients if they are ready for this a little bit stressful winning of the sperm. But most of the patients are catching this without problems. One of the next thing which happened before, for example, by some of the patients is that because they are sending the results of the scan of the cavity, we are monitoring if there are no polyps. Sometimes it happens that the polyps are visible in the cavity, and if the polyp is bigger than 5 millimeters, we are not insured to transfer the embryos inside the cavity, because this doesn't bring good outcomes in the treatment. In those situations, we better advise the patients to cancel the treatment at first, to remove the polyp, and in the next cycle, for example, transfer the embryos after the thawing and after freezing process.